In this video, we're going to be discussing the robotic screen only. So just what you see with the robot screen at the time of the surgery, what I'm looking at during surgery. So this is a standard varus knee, worn out on the inside, bone on bone. The first step that we're going to look at is limb alignment. So we have to teach the robot where your ankle is, where your knee is, and where your hip is. And we're going to show you that in a step-by-step fashion. So the first thing we do is define checkpoints, points that don't move on the femur and the tibia. Then we teach it the ankle, the medial and lateral malleoli, the bump on the ankles. Then we teach it the center of the tibia, the center of the femur, and now we're going to show it the hip center by taking the hip through a range of motion and capturing all these data points. Once we have all of these, we take the knee out straight and then show it a range of motion. The next step we're going to do is to show it where the bony anatomy is because it doesn't know where the bone is yet. So I'm going to take basically a robotic paintbrush and paint the edges of the femur. Everything in blue has to be painted. And so I'm actually painting that on the patient. And we paint all of the femur, both the medial and lateral side, the borders. We have to get everything anterior on the front. We have to get everything posterior on the way back. And once all the blue is gone, then we can set the rotation, which is what I'm doing here. The next thing I'm going to do is teach it the tibial anatomy. So same thing. We have to outline some of the tibia and show it, and it's going to create a three-dimensional model with those blue areas that it requires. And it needs some in the front, and it needs some on the medial tibial plateau and the lateral tibial plateau. So I keep painting until enough of that's gone that the computer is able to render a model of the knee. So if I need a little bit more, I will. So next, we're just going to kind of shift the implant, make sure it's on the center of the bone, just get everything ready. The next step is ligament tensioning. So we're going to tension the ligaments, the MCL and the LCL, in both extension and inflection. So you see here, that's extension. The knee is straight right now. And the next step is to test it in flexion. The orange line is the MCL, the purple bar is the LCL, and we're going to tension it in both. And if we are able to balance it, and when the knee is straight and when the knee is bent, we'll be happy. So now we're going to look at how we balance it. And this is a little bit challenging to explain on a lower level. So what I'll tell you is that I'm going to change the implant position to balance the ligaments. I can change the rotation of the femur. I can move the femur anterior and posterior. I can resect more tibial bone, and I can change the varus valgus of both the femur and the tibia. I can also change the femoral size. And all of these together give me the power to balance the knee so that I don't have to cut your ligaments during surgery, which causes more pain, more swelling, and dissatisfaction. So I'm trying to balance the knee without cutting the ligaments. And when I end up at a place where I'm happy with the lateral side slightly looser than the medial side, that's where I want to end up. And that's because we're trying to drive a medial pivot knee with the medial side tighter. The next step, we're going to resect the distal femur. And for this, I'm going to use the burr. Now, we have to redefine those checkpoints, make sure nothing has shifted during the surgery. So I redefine the femur checkpoint, redefine the tibia checkpoint, confirm that nothing shifted, and now I'm going to bring in the robotic burr and burr the distal femur. So pink means there is a lot of bone, blue means there's some, green means there's very little. And so I'm just going to resect it all. And you'll see there's two little dots in there that I also have to get. And that's because I've already set the rotation of the femur at this point. So I'm going to use a cutting block to make my other cuts after I get done. But I have to know the rotation to put the cutting block on. So once I get done removing the bone, I'm going to make this little hole right here for the guide of the cutting block. Then we're going to remove the other side of the bone here. So we've done the lateral condyle, now we're going to do the medial here. And this burr, it won't let me burr too much. So white is what we want. Some of the pink you see on the lateral femoral condyle, that's a little too much bone that was taken. But with the human eye, you can't see it. And when you put your finger on it, you can't even feel it. This burr is incredibly accurate. That's less than 1 millimeter of over resection. Sometimes really soft bone, you can cut a little bit, but this is way more accurate than a saw, because a saw can skive. So we're going to set the point here. So at this point, I'm making my additional femur cuts, the anterior cut in the front, the posterior cut, and the chamfer cuts, which are kind of the diagonal cuts. Now we're going to move on to the tibia. So in order to get some of the tibia bone out of the way, I'm going to use a saw, but I'm going to use robotic guidance to set the level of where I'm going to saw it. So I basically put a guide on and I'm going to pin it in place. And I'm using robotic technology to tell me where to put that guide. So I want that orange line on top of the blue line. And once they're there, I put 2 pins in it to hold it, and then I use the saw to cut it. Once I cut it with the saw, I remove that bone, and then I come back with the robotic burr. And so you're going to see here, I'm going to come back with the burr and remove a little bit more bone. So even though we made an incredibly accurate cut with the saw, that's called navigation. That's better than conventional knee replacement. It's still not as accurate as robotics. So we'll come in now and remove a little bit more bone and end up with a much more precise result. So what I'm going to do is try to debulk it, get rid of most of it. Now, the very edges are really difficult to get. So what I'm going to end up doing is coming back with a saw, but now I've got a nice flat platform to kind of get those very edges. The next step, we're going to be trialing implants, all right? So we put the implants in there, we test the range of motion, we test the stability, and we end up exactly where we want to be. So this is a knee that we're able to visualize. The robot was able to visualize all of the necessary anatomy, the ankle center, the knee center, the hip center. It was able to visualize the bony landmarks, right? The femur and the tibia bone. And then we were able to execute our plan by resecting the appropriate amount of bone and the appropriate orientation to end up with a perfect result.